So, this one, I don't like this one. And then you almost sometimes want to make it hurt more.
You shouldn't do that. This is an early stage oral cancer. It could actually slowly progress into advanced stage of cancer on the tongue.
Hey everyone, welcome to yet another episode of We Need to Talk About This.
And today we're going to be talking about something that's very near and dear to my mouth, ulcers. And we have with us Dr. Chelsea. Hi, Dr. Chelsea.
Hi.
What is an ulcer in the mouth?
So an ulcer is basically a painful sore that's in the mouth. It's due to a break in the mucosa that could be on the gums, on the cheeks, on the tongue, because there's a break in the skin in the mouth, so it's painful. So this photo here shows an ulcer that's on the floor of the mouth. You'll see
It's
an
that
ulcer.
little like yellowy white kind of piece right there?
Yeah, so that area is actually where the ulcer is. It's covered by basically dead skin cells,
Yeah.
right? Yeah, so it would usually heal in about 10, 14 days if you were to just leave it alone.
And that is 10 days too long, isn't it?
Yeah,
It is. It's painful. The other common ulcer that people do get is what we call recurrent apthous stomatitis, or RAS. So people with RAS, they generally have recurrent ulcers that would come and then go away and then come back again, usually not at the same spot, sometimes at the same spot.
Not trauma-induced.
Yeah, not trauma-induced.
Right.
It just comes up spontaneously.
Painful? Same pain?
Oh, those would usually hurt a lot, yeah. So
this one, I don't like this one.
Right.
This one I've had. And then you almost sometimes want to make it hurt more. You know
Just
what
so
I mean?
that you
Just
numb it.
so-
Something like that. I don't know,
Right.
there's something about it, you go,
Well, probably not the best. You shouldn't do that. But basically, for recurrent apthous stomatitis, there are actually underlying systemic problems. It could be due to lack of some nutrients, like lack of iron, lack
Okay.
of folic acid, vitamins.
You know what I have noticed is when I get this one is stress. After stress, I get ulcers.
Really?
Yeah.
Yeah.
Is that one of the...
Yeah. So studies have shown that stress, lack of sleep, and also allergy. Like if you're allergic to certain foods, that could trigger a bout of ulcers to come out. Last but not least, this ulcer here is on the left side of the tongue. If you can see, it doesn't look that painful as compared to the
Yeah,
ulcers
it
that
doesn't.
you've seen.
It doesn't.
There's
So-
no actual like sore.
Redness and all that,
Right.
yeah.
That
So
doesn't
this
look brutal.
actually was early stage tongue cancer that
Wow.
presents like an ulcer. This is an early stage oral cancer, and from that, it could actually slowly progress into this
That.
more advanced stage of cancer on the tongue. And then that would mean that you would have a poorer prognosis when you get it treated, right?
Right.
So this is probably advanced late stage oral cancer that's on the tongue, which likely developed from a small little ulcer that was left untreated and then became like that.
So I need to ask you the different stages of what could be tongue cancer. Do any of them hurt?
The very early stage, you may have a bit of discomfort. It wouldn't hurt as much as if you had traumatized it or if it was a recurrent aphthous. And then as it progresses, you may get a bit more pain. Up to this last advanced stage, I think it would be very painful for someone with this type of ulcers.
The messed up thing about that is you might not see it. Because if it's hiding in the back of your tongue there and it's not painful,
But usually the painful ulcers, you know when it's getting better or it's gone away, and then that's a telltale sign that it's gone away and it's all well. But if it's not, and then it's not really bothering you and it's just persistent, 2 weeks, 3 weeks, and it's not going away, then I think that's when you should go and see a doctor or dentist. If you come see a dentist, we would actually biopsy the ulcer. So that would mean that we'll have to take a little piece of the tissue from the area of the ulcer, submit to the lab just to make sure that there are no abnormal cells. And if it is, then we will have to actually treat it. And if it's not cancer, then that's good news. We would try to treat those ulcers with
Okay.
so if untreated,
medications.
then this is what prognosis is death.
I wouldn't say death. It all depends.
Lose your tongue.
You may, from the surgical excision removal of the cancer, you may lose part of the tongue or the tongue. You may end up having to get chemotherapy, radiation therapy.
Right.
Yeah, for oral cancer.
So I'm assuming that these right here are not going to fix the oral cancer.
Right,
No.
we're not gonna. Yeah, this
But
one's not.
Let's go take a-
These look familiar.
So I think we've prepared some home remedies that people are familiar with. We have ranging from gels to a rinse, to some powder, and then salt that we use at home. So this is a topical anesthetic gel. The contents of this gel actually has analgesic properties, so it helps to kind of pain relief,
Right.
and also some mild anti-inflammatory actions. So that kind of helps to reduce the inflammation that should help to
So it actually can
fasten the healing.
Yeah, so it
of
can
the
actually
ulcers.
shorten the
painful times.
Yeah, that's good. That's
Ulcer
Yeah.
time. What's
Yeah.
this one?
So this is a mouth rinse. It's an antiseptic, so it has some antibacterial properties where it would make sure that it doesn't get infected.
This
So
isn't typical mouthwash. You can buy it over the counter, though,
you
right?
could get
You
all this
could.
over the counter.
Okay.
Yeah, and then here locally we have this TCM or traditional Chinese medicine powder. It's quite commonly used where you would actually put it on the ulcer. It has a little cooling effect because it contains menthol and it kind of reduces the pain. It also has some anti-inflammatory properties. So it's supposed to shorten the time that it takes for the ulcers to heal.
Now, this I'm most familiar
school.
with.
Yeah.
Salt.
Yeah, that's
Yeah.
just table salt, right?
Right.
So you could use a salt water rinse, something that you could just use at home. Just a pinch of salt, dissolve it in water, and then just rinse it. That should help because the salt water helps to neutralize the pH and actually can help with healing of the ulcers.
Okay, neutralizes the pH.
Right. So I think the take-home message is if you have ulcers in the mouth, I think it's very easily detected. Just make sure that if you have ulcers, look in the mirror. If it doesn't look normal, you should then go and see your dentist and have it sorted out. And early detection, basically for oral ulcers, for oral cancer, is going to help a lot in terms of the treatment and the prognosis.
Well, that's a perfect note to end this on. Thank you so much, Dr. Chelsea. We appreciate it.
Thank you.
We'll see you next time because we need to talk about this. If you enjoyed this clip, don't forget to check out our main series, Let's Talk About Health on MeWatch.